Heart disease is the leading cause of death in the U.S., killing more than 600,000 men and women every year. In honor of Heart Month, People's Health cardiologist Dr. Pramilla Subramaniam joins us now to share some tips on how to keep your heart healthy and how to identify the risk.
Oh, that's correct.
Thanks for joining us.
Oh, thank you.
A lot of people have heart disease and they don't even know it.
That's right, because, you know, heart disease is just a big term that you use for a lot of things that affect the heart. For example, heart attacks affect the heart, valve disease affects the heart failure affects the heart. So specifically, when you're looking at heart disease, you have a big term, but then I think from our perspective, we're trying to talk about heart attacks in women.
All right, so what are some of the risk factors for heart attacks?
Well, there are basically 5 big risk factors. You know, high blood pressure is a risk factor for heart attacks. It's more important in women than in men. Diabetes is a risk factor. Again, it's more important in women than in men. Smoking, for example, is a risk factor. Cholesterol is a risk factor. And family history of early heart attacks is a big risk factor.
We were talking earlier and you said a lot of men present heart attack symptoms as a crushing chest pain. Women present heart attack symptoms differently. So you may be having a heart attack and not know it. Tell us about
absolutely. The symptoms that women present with when they have heart attacks are sometimes weakness, fatigue. They may have some burning feeling in their chest, which is like indigestion. You tend to ignore it because you think, oh, I just pulled a muscle because I did a little too much. So I think the most important thing for women to understand is that if they have any risk factors and they have any symptoms, even though they do not think it's important, they need to go see their primary care.
All right, a healthy diet, a lean, healthy diet is important too when it comes to you know, preventing heart attacks. But you say some people have never even gone to see a doctor.
That's right. You know, how do I know that I have high blood pressure unless I go see my primary care as a screening procedure? So everybody who's about 30 or 35 need to see a primary care. What is your blood pressure? What is your blood sugar like? Where do you stand with your cholesterol? So you can start changing your lifestyle as well as your diet.
And you've seen people in heart failure without even knowing they had a heart problem.
Absolutely. You know, the first time they ever present to the emergency room is when they're in an extreme situation where they have heart failure symptoms, and then you find out that their blood pressure is like 200 over something else, which is very high, and they never knew it.
Dr. Pramilla Subramaniam, thank you so much for joining us.
You're most welcome.